When you're running healthcare operations across 50 locations or 200 or 500, the math on staffing changes completely. You can't post job ads and wait 6 weeks to fill a credentialing role. You can't lose 3 billers in 1 month and hope the remaining team absorbs the workload, and you can't scale a new service line when your back office is already underwater, right? Enterprise healthcare outsourcing requires infrastructure that can deploy hundreds of trained specialists in days, not months. Infrastructure that can handle thousands of concurrent tasks without dropping quality or compliance. Most healthcare BPO vendors can't deliver that. And the ones that promise enterprise scale, well, they come with a 7-year contract, 4 to 6% of your net patient revenue and fees, and staff turnover that disrupts your operations every quarter. Let's be honest about what's broken in healthcare outsourcing. The big vendors lock you into contracts that span 7 to 10 years. Now, good luck getting out when service levels drop, and they charge 4 to 6% of your net patient revenue. On a $50 million health system, that is $2 to $3 million a year just in fees. KLAS research shows the consistent complaints: staff turnover that disrupts continuity, slow execution, poor follow-through on targets. One health system CEO said it bluntly. He said he would ask vendors for performance overviews and get spreadsheets with a bunch of data, but no insights. And then there's the offshore quality problem. Denials that expire before anyone touches them, turnaround times measured in weeks, not days, quality that varies widely depending on which team you get, and don't get me started on AI hype. Industry data shows only 15% of health systems are seeing positive ROI from AI investments in revenue cycles. So the rest are paying for experience. We built Staffingly to solve these problems and not add to them. So here's how we're different. No 7-year lock-ins, flexible engagement terms that scale with your needs. You can ramp up during acquisition periods and you can scale down when things stabilize. Not a percentage of revenue, actual dollars saved. Try getting that from big vendors. Transparent pricing that saves you up to 70% compared to in-house costs. So if you're spending $1 million on revenue cycle staff, you're down to $300,000 with us, and that is $700,000 back in your pocket. Dedicated teams with trained backup coverage, and you get the same specialists working with your account month after month. It's not a revolving door of offshore temps who don't know your workflows. Real-time dashboards with actionable insights, so there's no data dumps, actual analysis that tells you where the problems are and what to do about them. Quality SLAs we actually sign. Our clinical board audits 10% of all work product, turnaround in 48 to 72 hours, and it's not weeks. And look, we are 100% independent. There's no payer ownership, no conflicts of interest. We work for you, not for insurance companies. We're Staffingly. We're a US-based healthcare outsourcing company headquartered in New Jersey with our delivery center in India. Our India-based workforce includes licensed and educated healthcare professionals, MDs, RNs, PharmDs, and revenue cycle specialists who understand clinical documentation, payer requirements, and US healthcare compliance. They operate inside encrypted virtual desktop environments. Protected health information stays within your firewall and never on local devices. We offer 24/7 availability and bilingual English-Spanish support. We integrate with over 50 EMR and practice management systems: Epic, Athena, eClinicalWorks, Cerner, NextGen, whatever you run, we work inside it. We carry $5 million in liability coverage and have maintained 0 data breaches across 8 years and 800 client relationships. HIPAA, SOC 2 Type 2, HITRUST, ISO 27001, the compliance documentation your team needs ready when they ask. So look, if you're tired of vendors who overpromise and underdeliver, let's have a different conversation. Visit staffingly.com to schedule a discovery call or give us a call at 800-489-5877. Email support@staffingly.com. We'll show you what enterprise healthcare outsourcing looks like when it actually works. In the sections ahead, we're going to talk through how this applies to your specific organization type: MSOs and PE-backed groups, hospital systems, DSOs, specialty pharmacy, LTC pharmacy, behavioral health, and ASCs, each with unique workflows, payer dynamics, and compliance requirements. Management services, organizations, and PE-backed healthcare groups face unique challenges. You're integrating dozens of practices, each with different EHRs and billing workflows, and you need a partner who can move as fast as your deal flow, right? PE healthcare deal value hit $115 billion in 2024, but here's the problem. 88% of large healthcare bankruptcies last year involved PE-backed companies. Steward, Cano Health, Envision, they failed because growth outpaced operational infrastructure. Most MSOs don't struggle with the deals, they struggle with integration. And the big RCM vendors, well, they want 7-year contracts and they take 6 months to onboard a new acquisition. And that just doesn't work when you're closing 3 deals a quarter. Here's what we do differently for MSOs. 2-week onboarding for new acquisitions, not 6 months. When you close a deal, we can have credentialing and insurance verification teams operational within 14 days. So flexible engagement terms that scale with your portfolio. Ramp up during heavy acquisition periods, scale down when integration stabilizes, no 7-year lock-ins holding you hostage. Centralized reporting that rolls up to investor dashboards, real insights, not data dumps. Your PE sponsors get the KPIs that they need without you chasing spreadsheets, and dedicated pods for each portfolio company. Same team, same processes, same quality, not a revolving door of staff that doesn't know your workflows. So let's talk doctors. If your MSO is spending $1.2 million annually on revenue cycle staff, that drops to around $360,000 with Staffingly. That's $840,000 back in your pocket every year. Up to 70% savings, so money you can redirect into acquisitions, technology investments, or improving EBITDA before your next transaction. If you're managing a multi-location healthcare portfolio and your current vendor can't keep up with your deal flow, let's talk. Visit staffingly.com. You can give us a call at 800-489-5877 or email support@staffingly.com. We'll show you what MSO outsourcing looks like when it actually moves at deal speed. Hospital systems face a different set of challenges. Margin pressure is relentless. Labor costs keep climbing up, and the big RCM vendors, well, they want a percentage of your revenue, not a partnership. 40% of hospitals had negative operating margins in early 2025. Labor accounts for 50% of total costs. Contract labor spending jumped 258% between 2019 and 2022. Meanwhile, initial denial rates hit 11.81% in 2024. 75% of Medicare Advantage denials get overturned on appeal, but fewer than 1% are ever appealed. That's revenue walking out the door because your team doesn't have capacity, right? And the Change Healthcare attack showed what happens when you concentrate risk with a single vendor. 94% of hospitals reported financial impact. Some lost more than half their revenue for weeks. So here's how we solve these problems for hospital systems. Transparent pricing that saves you up to 70% compared to in-house costs, not percentage of revenue. Actual dollars that you keep. Prior authorization teams that deliver 48 to 72 hour turnaround and not weeks of waiting while patients get frustrated and causes get delayed. And cases get delayed. Denial management that actually appeals. We don't let that 75% overturn rate go to waste. We track patterns, prevent denials upstream, and recover the revenue that you're leaving behind. And redundant infrastructure, multiple clearinghouse relationships, no single point of failure. So when the next cyber event happens, you're not waiting weeks to process claims. Plus, we're 100% independent. There's no payer ownership, no conflicts of interest. We work for you. If your health system is spending $2 million annually on revenue cycle operations, that drops around $600,000 with Staffingly. That's $1.4 million back to you, and you can redirect that back to patient care, clinical technology, or margin recovery. Up to 70% savings without percentage of revenue fees eating into your margins. So if your healthcare system is tired of vendors who take a percentage of your revenue while also delivering spreadsheets instead of insights, let's talk. Visit Staffingly.com, call 800-489-5877, or send us an email at support@staffingly.com. The DSO market is projected to grow from $38 billion to nearly $200 billion by 2034. But dental billing is different from medical. CDT codes change constantly, over 200 changes since 2020. Generic RCM vendors, well, they don't understand dental. They give you offshore teams who've never seen a D4341 or know why a D2950 gets denied. Our India-based dental teams specialize in DSO billing, insurance verification in real time, CDT coding by specialists who know the codes payers scrutinize, and quality turnaround in 48 to 72 hours, so you're not waiting weeks. If your DSO is spending $500,000 annually on billing staff, that drops to around $150,000 with Staffingly. That's $350,000 back into practice growth every year, up to 70% savings with specialists who actually understand dental. So look, if your DSO needs dental-specific billing expertise without generic offshore quality problems, let's talk. Visit Staffingly.com, call 800-489-5877, or email support@staffingly.com. 87% of pharmacists say that prior authorization is the biggest barrier to getting patients on therapy. And 75% of faxed or phoned PAs take longer than 1 day to approve. For high-cost specialty drugs, that delay costs you patience, and most outsourcing vendors, well, they promise AI solutions for PA, but only 15% of organizations are seeing positive ROI from AI in revenue cycle. The technology just isn't ready. We use trained healthcare professionals, PharmDs, and licensed pharmacy technicians who understand clinical necessity arguments and the documentation that payers actually need. Human expertise with smart automation, not AI experiments. So if you're spending $400,000 annually on your PA team, that drops to around $120,000 with Staffingly. That's $280,000 you can reinvest in patient services. Up to 70% savings with proven expertise, not unproven AI. So if you want PA support that works today and not AI that might work someday, let's talk. Visit Staffingly.com, call 800-489-5877, or email support@staffingly.com. 60% of LTC pharmacies warn that they may close without congressional action. Part D revenues will drop 50% starting in 2026. Operating margins will decline by 35% by 2027. When margins are this tight, you can't afford vendors charging 4 to 6% of revenue. Our India-based LTC pharmacy teams help you survive margin compressions. Part D billing and reconciliation, cycle fill coordination, documentation that survives DIR fee audits. If you're spending $600,000 annually on billing operations, that's going to drop to around $180,000 with Staffingly. That's $420,000 to offset the margin compression that you're facing. Up to 70% savings at exactly the time that you need it the most. If margin compression is threatening your LTC pharmacy and percentage of revenue vendors are making it worse, let's talk. Visit Staffingly.com, call 800-489-5877, or email support@staffingly.com. ABA therapy requires multi-layer authorization, quarterly reauthorizations, 90-day documentation updates, BCBA credentialing that takes 90 to 150 days per payer. Generic RCM vendors do not understand this complexity. They give you offshore teams who miss reauthorization deadlines and let coverage lapse. 82% of psychologists report incorrect reimbursement rates. Over 70% of mental denials that complete appeals are overturned. But most vendors don't appeal because they're juggling too many clients with too few staff. Our India-based behavioral health teams specialize in ABA authorization, dedicated teams who know your workflows. Reauthorization tracking so nothing lapses, and we actually appeal denials. So if your ABA practice is spending $300,000 on administrative staff, that drops to around $90,000 with Staffingly. That's $210,000 that you can redirect into hiring BCBAs and RBTs, up to 70% savings with specialists who understand behavioral health. So if your ABA practice needs authorization support that actually understands behavioral health complexity, let's talk. Visit staffingly.com, call 800-489-5877, or email support@staffingly.com. Payers underpay ACSs by 7 to 11% on average. The AMA found a 19% claims processing error rate among commercial insurers, and 50% of denied ASC claims are never appealed. That's money that you're leaving on the table. Most RCM vendors give you generic offshore teams who don't understand ASC billing complexity. The implant billing issue, the conversion factor gaps, the underpayment patterns unique to surgical facilities. Our India-based ASC teams specialize in surgical billing, prior authorization, case-level coding, implant documentation, payment variance analysis that catches underpayments, and we actually appeal, because that 50% of unappealed denials is revenue that you should be recovering. So if your ASC is spending $800,000 annually on revenue cycle, that drops to $240,000 with Staffingly. That's $560,000 you can put into new equipment or expansion, up to 70% savings with specialists who understand surgical billing. If your ASC is losing revenue to underpayments and unappealed denials, let's fix that. Visit staffingly.com, call 800-489-5877, or email support@staffingly.com. All right, so here's what we've covered. The big healthcare outsourcing vendors lock you into 7-year contracts. They charge 4 to 6% of your revenue, deliver data dumps instead of insights, and struggle with offshore quality consistently. Only 15% of organizations are seeing ROI from their AI investments. Staffingly is different. Flexible terms, 70% cost savings, dedicated teams with quality SLAs, real insights from real dashboards. 48 to 72-hour turnaround, 100% independent with no payer conflicts. 800 clients, 8 years, 0 data breaches. So look, if you're ready for healthcare outsourcing that actually works, we're ready to listen. Visit staffingly.com to schedule a discovery call with our enterprise team. Call us at 800-489-5877 or email support@staffingly.com. Because look, because at Staffingly, you handle patient care, we handle everything else.